But I do love working in the NHS. Yes, it's got its problems. Yes, it's in trouble right now, but I do love working in the NHS. I want to ask you guys, how many of you in the last 2 years have used the NHS? Let's do a quick poll. How many of you have used the NHS in the last 2 years? It can be for anything, appointments or screening or vaccines, anything. Yeah, lots of us have. Lots of us have. I will be in that yes category as well. It's there for us. And this August will mark my 20th year working in the NHS. Please, someone tell me I don't look old enough, please. Someone? No. Thank you. Thank you. I know. And I'm really proud of working in the NHS. One of the things that, the main thing that really makes me proud of working in the NHS, it doesn't matter kind of how old you are, whether you're old or young, or whether you're rich or poor, you will still get treatment on the NHS free at the point of need. And yes, we pay for it through our taxes. We definitely do. And that's why it's our NHS, the British public. It doesn't belong to the government as much as they'd like to think it does. They're safeguarding it loosely while they're in power. But it belongs to us, the British public, and we've got to protect it. Now, I want you to think about the NHS, and then we can do a little word cloud. So if you can just type in very quickly the first word that comes to mind when you think of the NHS. Let's have a look. What have we got up here? Amazing. Stop it. Stop it. It is, isn't it? It's free at the point of need. Nurses, big part of the NHS. And there are some other words in there as well, which I think is important, isn't it? Awesome. Crap management, no staffing, overstretched. But I think even those words come from a point where we want it to be better, don't we? We want the management to be better. We want the funding to be better. We want it to be better appreciated. All the words, they're all brilliant words in there. Because whether they're positive or not, a lot of it comes from us wanting the NHS to be better. And we really do, because it's part of our British values. It's a British institution, isn't it? And it's really important that it stays that way. It's so important. They've tried, haven't they, over the last few years, they've tried to slag off the NHS, particularly certain branches of the media. They're slagging it off. They started with GPs. They say things like GPs aren't seeing anyone. They're saying things like you can't get an appointment with your GPs, and that's the fault of the GPs. It doesn't matter that in 2015 we were promised 6,000 extra GPs, and now we've got 1,000 less than when that promise was made. That doesn't matter. That doesn't matter. What matters is you can't see a GP, so it's the fault of the GPs that are working there. But they didn't stop there as well, did they? When nurses went on strike, when paramedics went on strike, when physios went on strike, they only went on strike so they could get fair pay. They only went on strike so they could provide better quality care to their patients. They only went on strike so they could just afford to eat, and they want to feed their kids. It's not too much to ask, is it? It's not too much to ask. But no, certain headlines were greedy nurses asking for unfair pay rises. But that's not true. That's not true. The NHS will be there for you when you need it, and we need you guys to be there for the NHS when we need it. What they're saying now to try and get kind of these waiting lists down, it's one of these horrendous 5 pledges, isn't it, that Rishi Sunak's come on, get the waiting list down. He just keeps repeating those 5 pledges. Get the waiting list. What he's doing is getting private companies in for NHS contracts, and that's really worrying. It has been going on for some time, and what he's doing now is opening the gates further so more private companies can come in and get NHS contracts. And on the surface of it, it sounds good. Certainly if you're a patient waiting for an appointment right now, it's not a bad thing on the surface. So let's say we've got a list of patients over here who are all waiting for their hernia to be repaired. And the list is you have to wait 2 years when you're on there. That's terrible. You shouldn't have to wait 2 years. We need a properly funded NHS so people can get their hernia repaired. So what happens is a private company will say, actually, look, the NHS is, that waiting list is too long. We will come and help. We'll help with that waiting list. Sounds good. But what they do then is say, well, actually, we can't see the people with hernias who've got type 2 diabetes or a respiratory condition or any underlying kidney disease because they need more care before and after their hernia repair. They need to spend more time in hospital recovering. So what we'll do, we'll take the people with hernias who haven't got any underlying conditions because we can do them as day cases and get paid exactly the same for them as the NHS contractors do for the patients who need a little bit more care. And what that does is take out all those patients patients that would have just had been a day case in the NHS so they could get through that list quicker, and it leaves all the complex patients who, through no fault of their own, take longer. And that destabilises the NHS. And that means it's unviable, and often those services then collapse. Then the private companies swoop in and say, okay, we will do that entire list now, we'll do the entire list, but we want more money per patient. And that's when our taxes go up, or when they start talking about health insurance, or when they start charging you to see your GP. And we've got to make sure that doesn't happen. The NHS has to be free at the point of need. This stealth privatisation is a real problem, and we've all got to stand up to it. We've all got to be wise to it. Yes, we've got to get those waiting lists down, but the way we do that is train more NHS staff, pay them properly so they stay in the NHS, treat them right so they don't go abroad, they stay in the NHS, we fund the NHS properly, and we get those waiting lists down that way, not by bringing in private companies. So important.